let us go to work for you. It's more to us. It's personal.
Golf for Good on Friday, September 12th. Register now.
No doubt we are all excited, safe to say, about the fall season right around the corner. None of us perhaps more than Dr. Marc Cromie with the Chattanooga Allergy Clinic. He's happy, am I safe to say, because you know you can help people,
That's right. At least we know what's going on now,
right.
Okay? So it's back to school, it's football season in Tennessee. Well, it's ragweed season in Tennessee. So we know that this is the major allergen that'll be out there. It's ragweed and wild weeds that are coming out, growing on the side of the roads and construction sites, etc. They're going to cause the classic symptoms: runny nose, sneezing, itching. And so we have a way of fixing that. We can treat you, we can test you, we can change the course of your disease all naturally through immunotherapy. So, but now's the time of year. Kids are back. Viral illnesses are on the rise, and this is the #1 time of the year for asthma exacerbations. People don't appreciate it. They think it's usually in the middle of the winter when it's really, really cold, but it's really because we're back to school. People have stopped their asthma medicines. They felt great all summer, and now they're back into this petri dish of bacteria, viral illnesses, dust mites in the school, as well as ragweed outside. So now's the time to get back on the meds to prevent these exacerbations, stay on your shots, and all that good stuff.
Okay, I want to ask you about the viral infection, because so often an allergy can mimic a cold, right? Or that viral infection you're talking about. So if you're coming into the school year and maybe your children have been fine and this is the first for you, how do you know which is which?
Well, allergies and viral illnesses have several similarities. They both will have a runny nose. They can both sneeze. You can cough with them sometimes. The difference is that in allergies, your drainage is going to be clear. You'll have more of a predominance of itching. There's no fever associated with it, okay? So you're not going to have the chills or the fatigue that's associated with viral illnesses. And then if you start having purulent yellow discharge, you know that you have more of a secondary infection. It can start as a virus and become a sinusitis, or in some young kids it becomes an ear infection with the pain related to it. So allergies is going to be more clear drainage. It's going to be more persistent. It may be every day. You can take an antihistamine, it goes away. With the viral illnesses, typically your symptoms are going to persist for 7 to 10 days with really no change.
Okay, you're talking about it being viral, and yet you mentioned that mucus kind of turning a color, and so often I think we think, oh, if that happens, I must need an antibiotic. Not the case?
Well, not the case. It has to do with the timing of it, okay? So if you have the yellow-green drainage that's lasted for a week or more, then I would say at about 10 days, we start treating it as a sinus infection or a bacterial infection. We all know it can start with a viral illness, and even it can start with allergies. And what happens is the sinuses will get plugged, get congested with inflammation, and everything stops draining. It becomes a plumbing issue, and then the inflammation begins, and then the secondary infection. So for me, it's not so much the color, it's the duration of the color. If you've got yellow-green drainage for a couple days, no big deal. If you've got it for 7 to 10 days and it's not getting better, then it's time to look for an antibiotic.
And just because I like to get in the weeds, what that means is if someone tells you, oh, you have a sinus infection, it didn't necessarily begin as a sinus infection, it morphed into it over time.
Correct. It could start with anything. It could start with just allergies. It didn't have to be a viral illness. It could have been the inflammation from exposure to your dog or cat or the ragweed that then led to the inflammation, and then that inflammation stopped everything from flowing, and then it backed up in your sinuses. The sinuses are just little hollow cavities in the skull that ventilate. And if they get blocked because of inflammation from allergies, stuffiness in the nose and congestion, then you can lead to sinus infections. So the ear, nose, and throat doctors, our good friends that are the surgeons, are one of our biggest referrals. They see kids that have chronic sinus infections. They kids with chronic ear infections. They've already put tubes in 2 or 3 times. They've taken out their tonsils. Allergies are triggers. They're the reason for these infections more than anything.
So that's a problem, these repeated sinus infections, in terms of kids missing school. Often parents are having to stay off from work. So if they're thinking, okay, maybe allergy shots are going to be right for me, and as a child, typically how long before you begin to see some improvement?
All right, so typically the way the allergy shots work, and that's a great question, because what we're doing is we're not giving them an injection of any medicines. There's no steroids, there's no preservatives, there's no antihistamines in these. It's purified pollens, dog and cat dander. So after we do our skin testing on you, I will tailor make allergy shots for these patients with little bits of these. And what we're doing is we're teaching the immune system, which is overreacting. By definition, allergy is your immune system system overreacting to something harmless. There's nothing dangerous about peanut butter. There's nothing dangerous about dog or cat dander or pollens, but if you're allergic to it, your immune system is attacking that allergen. When you breathe it in, it causes inflammation, it causes sneezing, congestion, release of histamines and leukotrienes and other mediators that cause all this inflammation. By giving you a teeny injection of what you're allergic to weekly in the beginning, then eventually every 2 weeks, your immune system starts to see, hey, there's nothing wrong with these allergens. Why am I going crazy? And it creates antibodies protective against these allergens. And basically it's called immunotherapy. We're using your immune system to treat this, but there's a change. We're changing the course of the disease. Usually within 3 to 6 months, people can start to tell a difference, but then every season it gets better and better. And the majority of patients will stay on these shots twice a month for the course of 3 to 5 years. But the studies show that if you start them early enough in childhood, 6 to 12 years of age, it can prevent asthma from developing by 50%. So asthma kills 3,000 people a year. This is completely avoidable. So if you've got a child that has eczema, dry skin, food allergies, if you've had runny nose and sneezing every spring, fall, now's the time to get them in when they're younger so we can change the course of their allergic march and change the course of their disease forever.
Okay, that's going to take up our time. I have 1 minute left. So in that time, I will tell you this too, the allergy shots he's referencing, think long and hard about which location is closest to you, because that's where your serum will
That's
stay,
right. We have 8 locations to serve you. You can see me at any one of these for testing, but then say, oh, I need to get my shots in Jasper, Kimball, Dayton. I got to get them in Fort Oglethorpe. You can do that. And we have shot rooms that are open 5 to 6 days a week.
All right, good to see you.
Always.
You know what? You've been coming our way since the show started. I've never seen you sneeze or have a sniffle.
You know why?
Because
I did shots when I was a kid.
Is that
My
really
mom took
why?
me. Yeah, I went to the Atlanta Allergy Group,
I remember
and I was
them.
on allergy shots for years. And Dr. Scott Carroll, who started it, was my hero, and I wanted to be an allergist like him because he changed my life.
I never knew it.
Yeah.
Good to see you, my friend. Chattanooga Allergy Clinic, you heard all the locations that they have. Dr. Cromie, the full team there, will be happy to help you. 899-0431, that's the phone number.
I'm Ultima Morgan of Morgan & Morgan. Every time one of my children started driving, it was terrifying. I am quite aware of the dangers being on the road.